So dear friends, colleagues, service users, carers, mental health advocates, it gives me such great pleasure to share with you today, 75 years on since the inception of the World Federation for Mental Health. You know, in this world where we do appraisals and validations and reconsider what we've done, this is an important milestone in our life. This is the time where we should stop and think, what have we reached? Where have we not done as well? What was our mission 75 years ago? And has that evolved? Has that changed today? So let me bring you back to 1948, summer, August, in London, at Westminster City Hall. That was the first conference of the World Federation for Mental Health. Some 240 countries traveled around the world to attend that, representatives to attend that meeting. And it was not easy to travel after the war. London was still rebuilding itself, but mental health was a priority. The world had promised itself that it would change. It would be a different world. People will live in peace. There'll be no more wars. There'll be a United Nations and a Security Council, and citizens of the world will live together. It was even then seen as a challenge. But King George, who wrote this superb letter to the conference, stated, he says, we count on you. We count on you, mental health professionals. One, to advance the various approaches of therapy and treatment to people who suffer from mental problems. But we also count on you to help the citizens of the world to live in peace. It was such a huge charge. So let me take those 2 points in our initial mission and review those with you today. We have done a lot in the field of mental health, probably a little bit in the field of development of treatment and the biological end of psychiatry. But the real advancement that we've changed, and much of the credit to that goes to the Federation, is the global attitude to people with mental health problems. The attitudes of our communities, the closing of the large asylums in many parts in the world, the assimilation of people with mental illness in our communities, in our schools, in our workplaces, has been remarkable. And the anti-stigma campaigns have changed the world today. I can think many examples beyond the time allocated to us today. But I remember back in the late 80s, early 90s, the famous situation on the island of Leros in Greece and the mental hospitals there, the large asylums in the UK and various parts of the world, including some in Egypt here that I've witnessed myself. Attitudes have changed. Laws have changed. There are mental health legislations around the world today protecting the rights of people with mental illness. And let us not forget the role of the non-government organization, the organizations that have helped and supported bodies like the World Federation. So to answer our initial question, I will say, I think we've done well on the advancement of management of mental health issues globally. We've done well with our mental health campaigns. We've done well with advocating for World Mental Health Day. And I'm in heavens with the topic of World Mental Health Day this year. This is being a global priority. Human rights is a global priority. And I do think that that part of our mission we've done well. Now, have we done well in supporting peace around the world and citizens learning how to live each other? I'm not sure. I think the world is not in a very good place in many parts of the world today. It's difficult to say in retrospect whether the work of mental health professionals and advocates has had an impact. It probably did. It might have been even worse had it not been for people with a sound mission like the Federation saying this is how societies should live together. Diversity has become an accepted principle in advocacy work, and acceptance of people's various association, racial organizations, religious organizations have all worked well together on that field. So I dare say probably we have, in a way, helped on that front too. But where does that take us next? We are today in a position, in a good position, I have to say, in moving forward with our priorities. We, as a federation, as a well-structured federation with good governance and good management, we're financially sound. I'm proud to say we're one of the few organizations who haven't really had to bend their rules for financial survival. I remember back in 2019 in our World Congress in Buenos Aires, when the first suggestion was that we no longer accept pharmaceutical donations to the Federation. To tell you the truth, I was worried. I thought we might be broke, but we weren't. And there seems to be a number of donors around the world who appreciate the value of standing by our ethics and being able to be vocal. It isn't always ideal the way the business world, the pharmaceutical industry has dealt with mental health priorities versus economic benefits on those levels. So let me take you back to our mission in 75 years. What we would be doing is moving forward with a strong message of advocacy for people with mental health issues, a strong message of advocacy for their carers, a strong message of policy makers not only in the legal sense, but among schools and among camps and among youth organizations, where inclusion is a priority in our setups. We have to make sure that those of us who've suffered the consequences of mental health problems, either as service users or as carers, are well represented in those organizations. We must be able to go out and tell our schools that, look, the world has evolved, and you have to include students rather than penalize them for having mental health issues. And you know what? The world does listen. Every time we've been vocal about this, and sometimes really quite surprisingly, in the most unusual situations, we have come up with this message, and we've only been met by open arms and people really willing to make changes on those grounds. So this is where I see we're going. I also see that the organization of large federations like the WFMH used to thrive to a great part for the messages on conferences and traveling and World Congress and regional congresses. That will go on. But the COVID experience globally has changed that. Conferences with thousands of people attending with them is something of the past. A hybrid conference and online conferences are going to be probably the rule from now on. Quite successfully in many cases as well. I personally never felt it was really justifiable, the amount of conferences and organizations and meetings that were taking place nearly weekly within the field of mental health on a global level. I don't know that there were justifications for that. And I think the world has moved into a better place now, where the important part of the conference, i.e. transmitting messages, reviewing research, supporting messages of advocacy, will continue, but will continue mostly online. The dining and wining of the people attending the conferences will dwindle down, and that is not a bad thing, I have to admit to you there. We will also support clinicians in being selective and careful with their choice of classifications, labels that have been used. There's been a plethora of those. And I think clinicians need to be aware of the impact of those labels once they're out there, with the power of social media behind them, and how they affect the lives of average citizens in our world. So these are but a few of our priorities. The Federation has supported the rights of women in mental health, very active campaign. The Federation is moving quickly in the direction of setting up its own scientific journal in the name of the Federation. Like many other journals today, it will be an online journal, but shared with not just the professionals, but also the service users, the advocacy groups, and the policy makers, all work together to help individuals within the field of mental health. Last but not least, I want to tell you that I see a bright future for our federation. The way things have gone the last years can only predict that the coming decade is going to be a flourishing one. With the kind of support, the numbers are on the increase, the number of organizations are on the increase. And I've actually found, because I've worked both in the field of mental health as well as the field of medicine and psychiatry, I found that mental health in the broad sense, professionals and the service users and the advocacy groups are able to collaborate very well together, often I would say better than us doctors have in the past. So it is exciting, and I see an impressive decade ahead of us. I look forward to our continued collaboration, and I look forward to the future boards of the World Federation for Mental Health carrying the flag forward. Thank you all.